A heart attack is where the heart has a blockage in one of its blood vessels. This leads to the heart not getting enough blood and not enough oxygen, and sadly, hence dying. Large heart attacks lead to a large portion of the heart muscle dying. But if you're lucky, you can have a smaller heart attack, which is a smaller portion of the muscle, and these can be treated. The heart has its own blood supply and blood vessels called coronary arteries and veins, and these can get blocked in one of two ways.
Number 1. A blood clot can travel from elsewhere to a small coronary vessel, causing that vessel to get blocked, hence heart attack. Numero 2. The lumen of the coronary vessel can just narrow and get smaller and smaller with the buildup of plaque and fatty deposits in the vessel, eventually occluding it completely.
So how do doctors diagnose a heart attack? Well, firstly, you can diagnose it clinically based on a patient's symptoms. Most patients present with severe type chest pain, or some patients, such as those with diabetes, may even get pain around the epigastric area, the upper tummy area. This can also be caused by a heart attack. Sometimes the chest pain may be accompanied by other symptoms such as shortness of breath, or palpitations where you feel like your heart's racing, or even an episode of a total loss of consciousness. Doctors will often do an ECG, which stands for an electrocardiogram.
This allows us to lead the electricity passing through the heart muscle. If part of the heart is damaged or dead, the flow of electricity changes, and we can spot this.
A blood test for a protein called troponin is also commonly taken here in the UK. This is usually released into the blood when you get cardiac tissue damage, but it can also be released in other cardiac arrhythmias. So, how do we treat a heart attack? Well, essentially, the main aim is to restore blood flow to that area of the heart, and this can be done in one of two ways. Firstly, 1, with medications, 2, with mechanical intervention in the heart. Metallic stents can be placed by a cardiologist in the blocked arteries and are expanded, opening up the vessel to allow blood to flow through, hence revascularizing this area of the heart. The second aim of treatment revolves around prevention. Essentially, this is doctors trying to reduce a patient's risks of having further heart attacks. This can be done by healthy eating, cutting down the amount of alcohol you drink, stopping smoking if you're a smoker, exercising more. You can also start secondary prevention medications such as statins, which can help you lose unwanted fat. So that was a very quick whistle-stop tour of heart attacks, otherwise known as myocardial infarctions. If you ever see anyone having chest pain or difficulty breathing, be sure to dial 999 and get medical attention as soon as possible.